What's up, everybody? We are four very fine physical therapists at Physical Therapy San Pedro. And today we're going to talk to you about knee pain, specifically how fixing your knee pain is a lot simpler than you think it is. I'm Dr. Janae Brown. I'm joined by my favorite three physical therapists.
Dr. D.
Dr. Bay.
Dr. Sandoval.
So let's dive in, guys. We're talking about the knee today, and I wrote this blog this time. My goal was to sort of talk about the knee because recently I went to the American Physical Therapy Association's combined section meeting. It's our yearly annual meeting, and knee pain was a really hot topic at this conference, and it typically is, but there was a lot of different educational sessions regarding knee pain. And so I wanted to kind of use this as an opportunity to develop a series and sort of bring the knee to you guys and us discuss it all together. We see the knee also a lot in our clinic here. It is one of the most common areas of the body that we see here, and injured areas we see. So that was my reason for writing the blog about this. Also, I feel like, and I don't know if you guys feel the same way, but I feel like there are very easy ways to sort of help reduce knee pain. That doesn't necessarily mean that on their own, on our listeners' own, they can reduce their knee injury or rehab their knee injury on their own. But I feel like there are some simple tips that we can give them to reduce knee pain if they aren't in the position to go seek out, care from a provider, or don't have somebody in their area that they would want to see. So I'm going to have Dr. D start. He's going to give us two really simple things that we can do to right away. So these are your take-home tips. These are your application items right away that you guys can do to help reduce your knee pain. So shoot, Dr. D. What are they? What can these people do?
Two things. I think one of the easiest things that you can do is just modifying your symptoms, right? So a lot of times when you go to the doctors, they'll say, say you have an injury from running. And they'll say, okay, just don't run. Mm-hmm. Doesn't really get to the point, right? It doesn't really solve the solution. It's not really a solution for you. Yeah. So say if you can't run, you might just start off with walking. Right, starting off at a relatively lower intensity, make sure that you can walk normally first. Maybe you can start to increase the speed of walking, changing the terrain of walking. That way we're not doing nothing, because resting isn't really a treatment or an intervention as well. So say back squatting, same kind of concept. If we can't back squat without pain, might have to do a goblet squat. We might even have to start off with a wall sit. So something relatively similar to it, relatively similar type of stimulus, so that we can progress towards what we really want to do at that point. The second part is graded exposure. So we just build on it. Right? So say going back to the concept of squatting. I can't back squat yet, so I'm going to start off with wall sits. I can first start off with just 10 seconds. That's all I can do at this point for this week. I'm going to add 10 seconds the following week, and we gradually increase that. And there's a lot of variables, right? So thinking about the biomechanics, how we move. So that's why we exist in the first place. So that's how we modify certain things. And we can change the equipment, sets, reps, the load. There's a lot of variables that we can change initially. And that way we can start to measure progress. Because if we can't measure it, we can't really tell if we're actually progressing or not. Right. It might feel good certain days. Rehab, that's just part of the thing is, it's almost like a roller coaster ride. There's certain days that are better, certain days that aren't. But if we have certain numbers that we're measuring, it's easier to objectify our progress.
Right.
Yeah.
Perfect. Mm-hmm. So it's funny because we've all seen those like memes, right? That say like, my knee hurts when I run. And then the doctor says, well, don't run, right? That's what you said. You started off with, right? And it's kind of cliche because it's kind of true. But the problem is, that's not where we stop. Like, I think the problem is a lot of people think, well, I want to run. So like, if I need to run and you tell me to stop running, how do I really get rid of my knee pain? Mm-hmm. And so that's probably where what we call more of the symptom modification, right? Like modify the things that that you have difficulty with, not with the goal that you're not going to be able to get back to running, but with the goal that, okay, if I stop running right now because it hurts and I do other things to help my knee heal, then eventually I'm going to grade my exposure back to running, over time, right? Okay.
Yeah, because I think the most important part for us is just filling in the gaps, right? Yeah. So, I mean, I'm always going to go back to squats because I like squatting, but if we're starting off at the wall
you
sit.
like squatting with your heels lifted.
Yes.
Specifically.
Yes, specifically. So if I'm starting off with just a regular wall sit at the beginning and my end goal is back squatting, say like 315 or something like that, our goal for me.
That's all you're going to do? 315?
Is just making sure we're taking the necessary steps in between the starting point A and point B. So, and that could be, all the factors that I mentioned and just applying those concepts. So,
yeah, great. Mm-hmm. So, any other thoughts on that? Symptom modification, graded exposure. Do you guys have any thoughts down there? Anything that Dr. D missed? Anything you want to add?
No, they're just so important. I mean, if you stop altogether, the road back to where you want to be is so long.
Mm-hmm. Yeah.
So something is better than nothing, always.
That's true.
I agree.
Yeah, I think one of the things too is, this is something that I've experienced. It's hard to tell an athlete to not do something. It's hard to tell a runner to not run. And so you kind of have to meet some of these people in the middle, some of these athletes in the middle, and, really, modify their activities based off of their symptoms and, gradually progress them back to where they want to be. And so that's just another thing that came to mind when you were talking about the memes, what do doctors tell their patients? Well, don't run. That's not really the end all be all.
It's not a fun answer to receive.
Mm-mm.
Right. Okay, so what happens when, Dr. Sandoval, since you're already talking to me, yes. What happens when someone struggles with these two things? What if a person they don't know how to modify symptoms, or they're not good at it, or they don't really know how to grade their exposure because they keep trying to go back to something and it hurts and they don't know really where the space is between the two of those things?
Yeah, I think that goes back to something that Dr. D said. That's where we come in, and that's where physical therapists really fill in the gaps with guiding the patients back to their goals, right? Their activities that they want to perform. A lot of people seek out other individuals that have different practices, like personal trainers, chiropractors, even surgeons, mm-hmm. and they can definitely help with getting people to feel better. But at the end of the day, when it comes down to assessing movement and guiding the person back to what it is that they need to do for their daily lives or their goals of getting back to a specific sport, that's where we come in, and we help assess those movements, and we help get them back to those things, right? Yeah. So I think at the end of the day, if someone's going through an injury, come in to physical therapy, San Pedro, and we'll help guide you back to running.
We are the experts.
Yes.
Yeah, and I always like to tell patients, like my examples, like, well, a postman, delivers mail, right? A surgeon does surgery. A physical therapist rehabilitates an injury. So mm-hmm. we all have a great purpose. There are times when our patients are going to need surgery. Mm-hmm. They might come to us initially and they're not sure if they need surgery or they don't. But and we take them through that rehabilitative process, and we might determine that they do need it, that we're not going to be able to help them. That does happen. Not very often, but that does happen. So we just need to be able to go to the place that's going to help us the most, right? Someone walks in our door and wants to lose weight and says, can you help me with losing weight? No, we can't, but our roommates all fit.
Yeah.
Gym in San Pedro, they can help you lose weight. We will refer you to them.
Yep.
Right? They're personal trainers. They have weight loss programs.
Yeah.
Yeah, I feel like all of these practices have their time and place, but when it comes down to rehab, we are rehab experts. We know rehab. We know how to get people back to what they want to do.
Yeah.
So
it's good stuff. Okay, so Dr. Bay, you're
Yes.
up. Talk to me about what are some reasons, and you give me just a brief little gist. We got our knee model here. A little gist of why someone would have knee pain. What are some common conditions that we see with knee pain? And we're going to touch on these because we're
Yeah.
actually going to go into these more in depth over the next several months.
Spoiler. More need to come.
But touch on a little bit because we want to send them with some, some education here.
Exactly. So I wanted to help you understand a few of the common conditions that might be associated with knee pain. So the first two have to do with tendons. So tendons connect muscle to bone. So the patellar tendon up here, our quadricep muscle, attaches via the patellar tendon to the rest of the knee. And then on the inner border of our knee, the common tendon for some hamstring and adductor muscles, which is kind of like inner thigh, that's the pes anserine, that tendon. Those two, with a lot of repeated stress, can be very common causes of knee pain. We also have ligamentous sprains. Those are, again, stretch injuries. So we have 4 major ligaments in the knee. You can see them more easily via the back, the ACL and the PCL. The MCL is on the medial border of our knee, and the LCL is on the lateral border of our knee. Those we see a lot with our athletes. Also, very common in trauma or non-contact and contact injuries are meniscus. So on this model, these are in bright blue. Those are the padding between our tibia and femoral joint. And then lastly, strains of the muscles. The big muscles are large muscle on the front of the thigh, our quadriceps, and then on the backside, our hamstrings, overstretch or pulling mechanisms for those. Those are some of our very common causes of knee pain.
Wonderful. Great short description because we don't want to spoil all the good stuff that's coming in the future. Okay, so we when a person has knee pain and they come into our clinic, we essentially, no matter what condition they have, that Dr. Bay, so these are our common ones we see. There's a lot more.
There's more,
Yeah.
but these are some big
Yeah.
big players.
Yeah, there's some big players. But when someone comes in, we pretty much approach our patients sort of the same, right? Do they have full mobility, range of motion? Is there any swelling in their knee? Do they have, what's their strength like? What is their balance like? Are they stable? Can they walk? Can they go up and down stairs? Do they play sports? What are the limitations they have in their daily life that we need to help get them back to? So we're sort of looking at all those same things across these. And a lot of these particular conditions have the same similar problems, right? But there are differences. And so in how we approach each injury and rehab each injury is based on what does that particular injury have different from the next. So give me an example, you guys, of how you would approach maybe, I'll ask Dr. D, a patient that has patellar tendinopathy. How would you approach that person different from somebody who might have like a meniscal tear? What would you say, give them an example of, okay, if everybody in their minds, well, if knee pain is all treated the same, then there's not much different, but there is, and what might be different with those two conditions and how we would approach that patient?
So kind of going back to symptom modification, right? The symptom modification might be a little bit different based off of those particular injuries because a lot of times with patellar tendinopathy or I guess tendon-related injuries itself, it's a lot more of a load management issue. It's just repetitive movements that puts a lot of stress on the tendon itself. So that movement might be a little bit different that we modify versus a meniscus injury where it's more torsion related. So they might be more sensitive to changing directions, side to side type of movements, rotational movements. So that might be modified in those particular cases too. So obviously every person is going to be different.
Yeah.
With the patellar tendon, they might be sensitive to torsion too.
Yeah.
But generally speaking, that kind of differentiates how we would initially approach some of those injuries. Yeah.
Perfect. What functional limitation, Dr. Bay, would
Oh no.
would they have no idea. what functional limitation might someone with patellar tendinopathy complain of?
Well, typically motions that might require a lengthening to the quadriceps. So we call that an eccentric contraction. So a big one that I think of is coming downstairs, or even like quick stops, like where they have to decelerate rapidly.
And what about meniscus, Dr. Sandoval?
Oh, meniscus.
What might be a functional limitation? Like somebody would say, I'm having trouble with this, and that might make you go, it might be your meniscus.
Interesting. What I've actually found recently is people have an issue with getting full knee flexion, getting down, especially in the loaded position, and like Dr. D was saying,
heels.
yeah, like butt to
Butt
heels.
to heels.
Yeah, and then like what Dr. D was saying, anything that involves pivoting, right? And then I hear a lot people telling me that they hear a lot of clicking and catching, or they feel that it's restricted, right? They feel like it's stopping and then it suddenly moves all over again. So that's typically what I have found.
Yeah.
Yeah.
Perfect. Yeah. And these are just a couple examples of sort of based on those things, we'd approach that person different. For example, if someone had a hamstring strain, we wouldn't really start like, maybe activities that involved lengthening the hamstring right away, right? We might focus on some strengthening and shortening and things that are, going to tighten that puppy up. We're not going to keep stretching it, right? And doing hamstring stretching, right? With a hamstring strain. Whereas somebody that, maybe has a sprain and has some hamstring tightness, we might put hamstring stretching in their program, right? So we're looking like at all these different knee problems, limitations, and going, okay, we don't want to irritate that structure. But how can we help this knee heal without irritating the structure that is problematic, essentially, right? Cool. Well, you guys, this is a little gist, right? So you got to stay tuned because we're going to come back with lots of details, some anatomy, some examples, some rehab examples of how we would specifically rehab, some of these areas together. So if you have one that you really want to know about, let us know. Comment on, anywhere on our posts. You can comment on the blog post on our website at physicaltherapysanpedro.com. If you want us to talk specifically about one of these knee injuries, we're going to choose a few. So we will definitely approach the ones that you guys feel are most important or you guys want to hear about. So let's see. Is there any other thoughts you guys have on knee pain? Generally speaking, knee pain.
No, I think we covered it.
Covered it? Good. Cool. Okay. Like I said, you guys can subscribe to our blog. So subscribe on physicaltherapysanpedro.com. You can comment, share, all that stuff on Facebook and Instagram. And stay tuned for our knee series where we cover all these different fun diagnoses and give you guys a little bit of education. Thank you guys for tuning in. We'll see you next time. Bye.